Hello and welcome to Senior Living TV, the program on topics of interest for seniors and for the community at large. Our program today is Your Eyes and You. I am Lynn Brennan, your host, and our very special guest today is Dr. Krystal Rogge. She's an optometrist of 6 years, currently practicing at Eye Care Specialists in Lincoln, Nebraska. Welcome, Dr. Rogge.
Thank you very much for having me. I'm excited to be here.
Yes, me too. Well, in an earlier program, we talked about your voice and you, and we covered, how and where the voice is, how it works. Well, today we're going to address the eyes and you. And let me just stop for a moment and say here that we humans, Homo sapiens, our bodies are absolute miracles of God in every part of our living, breathing bodies, and especially today, our eyes. So, Dr. Rogge, let's take a look at the human eye and this scientific wonder and talk about the anatomy of the eye. Could you go through that for us?
Yeah, absolutely. So I believe you'll have an image on the screen, and I'm just going to start with the left-hand side of that image. So that's the front part of the eye. So at the very front, we have the cornea, and that's where if someone wears contact lenses, your contact lens will sit on that part of the eye. And right behind the cornea is the iris. That's the colored part of our eye. And behind that is the lens. So it kind of looks like an oblong egg shape there, but that's our natural lens. And all that orange that you see behind there is called the retina. The retina is the part of the eye that helps us see. And then at the very back, the very center back part there, you see the macula, and then the optic nerve that jets out right down there at the bottom. And we'll talk a little bit more as we kind of go through things, what all of those do, because they're all very remarkable structures. It's an amazing organ.
So a little more about the anatomy. So the color, the iris, the color of the eye is determined by
how much pigment we have. So a lot of times when we're born with light eyes or blue eyes, and so sometimes a little bit gray, but as time goes on, we'll gain more and more pigment. And it's hard to know, people always ask me, well, how do I know what color my child's eyes are going to be? Will I know at 6 months? Will I know at a year? They can change up to 1.5 years. So but it's brown eyes have more pigment and blue eyes have less. So.
And that's hereditary?
Yeah, well, it's all genetic, so, yep.
Oh, okay.
Mm-hmm.
Oh, that's interesting.
Yeah.
Okay, so then a second diagram, we'd like to know, how the eye works. How do we see? There's an apple there.
Yes, it is so interesting. So when we look at an image, there's light basically reflected off that image, and that light enters the eye. And it enters through the cornea and then through our natural lens, which bends the light in different ways so that it will form that image on the back part of the eye, mainly the macula. So that's the part of the eye that's responsible for our crisp central color vision. And if everything stopped there, then we would see upside down. Everything, just because it's upside down because of the way that the light bends. But because of the amazing structure at the back of the eye, the retina, there's photoreceptors and special cells that take that light, put it into energy, and then those signals are sent through the optic nerve in the very back, and it carries it all the way to the brain. And the brain, the very back part, the occipital lobe, is what takes that information and flips it back right side up.
And so how does it work? If people have said it works like a camera.
Yes, so we refer to the eye as a camera a lot because if we're looking at the human eye, the retina is like the film of the camera. And the lens, where cataracts develop, our natural lens, that's like the lens of the camera. And so is the cornea as well. But let's say if, I tell patients, if you have cataracts and you're not seeing well, that's like the lens of the camera. And there's only so much I can do with glasses to get that vision better. But with cataract surgery, they remove that and put in a clean lens, so that takes care of that.
Well, and we'll be talking more about that later, too.
Yeah, we will. Yeah.
Wow, it's already amazing.
It is. I think so too.
You learn all this in school, I guess. By the way, could you clarify for us the difference between an optometrist and an ophthalmologist?
Yeah, absolutely. So an optometrist like me, patients will have a yearly exam with us, and we look at not only the glasses and the contacts aspect, like correcting the vision, but we also look at the eye health. And so I would say that's the most important part. But typically when you come in for an exam, we take a photo of the back of the eye, or we dilate, because we want to be able to see the entire back side of the eye, making sure everything's looking nice and healthy. If there's something wrong, we manage things, other diseases, but if somebody needs surgery, like cataract surgery, or if they have something wrong with the back part that needs injections or something like that, then that's when we send to an ophthalmologist who is more on the surgical end of things.
So the ophthalmologist is the ophthalmologist an MD?
Yes. Yep.
Oh,
yep.
okay.
An ophthalmologist is an MD. So they go through medical school, and then they specialize in the eyes for 4 years.
Oh,
Yep.
interesting.
Mm-hmm.
Okay.
Yeah.
So are we all born with 20/20 vision? And exactly what does 20/20 vision mean?
We are not born with 20/20 vision. So we'll get into, what nearsightedness is and farsightedness. But to put it simply, when we're born, our eyes are very small. And so we're all born farsighted.
Oh, really?
And as we continue to grow, eventually we get to the point where some of us, if everything's going naturally, then we will lose some of that farsightedness. And if the eye stops growing at the optimum measurement or the optimum size, then all the light that enters lands on the back of the eye, and we need no correction at all. If the eye continues to grow, then we become nearsighted. So I guess the simple answer is no, we don't. We are not born with 20/20 vision. But then to go back to what 20/20 means.
Right.
So, coming into an exam, you sit down in your exam chair and you're looking at a chart. So the top number is how far you are in feet, how far you are from the chart. So you might say, well, I'm not 20 feet from that wall over there, but we use different mirrors, and it's all calibrated so that you see an image that is at 20 feet away. So that's the top number. The bottom number is the distance at which a person with normal vision would see that same image at. So let's say, for example, 20/50. So that means you are sitting at 20 feet seeing an image, whereas somebody with normal vision would be seeing that from 50 feet away instead of 20. So 20/50 is not as good as 20/20. So you would have to sit at 20 feet to see something that someone with normal vision could see way back there at 50 feet.
And so you're 20/50.
I'm not 20/50.
No,
Yes. Yeah, so you would be 20/50.
Right.
Yep.
So, but I don't think we're ever really told that when we have an eye exam. Oh, you're 20 whatever.
Yeah. Well, when you're sitting down, our aim is to get you 20/20 or better, But there's certain things going on with the eye, there's lots of things, dry eye, cataracts, all sorts of things that can make that not possible. But yeah, that's our goal.
Okay. All right. Interesting. Well, okay. So brings us to the question that why do most people have declining eye health over time?
Yeah, there's a lot of reasons for that. That's kind of a loaded question, but there's a lot of things that we can do in our own life, our lifestyle, how we eat, how we take care of our bodies, that can affect our eye health. If someone sees their primary care doctor every year and they have high blood pressure or high cholesterol, making sure that we're taking the medications that we need to control that, or changing our lifestyle to better that affects eye health.
So a lot of different things as far as our personal health impact the eyes.
Oh, yes.
Wow. Interesting.
Yeah.
And then you have poor heart health affects blood vessels. So
Yep.
how do blood vessels relate to vision?
Yeah. Well, as we talked about the eye being just the most extraordinary organ, it needs blood. It needs oxygen from blood for it to continue to function like it's supposed to. And the heart is pumping all that blood throughout our body. And we need good heart health so that we can keep everything else in our body healthy. And speaking of blood and circulating throughout our body, we talked about cholesterol, keeping good cholesterol. Let's say if you have high cholesterol, then those blood vessels are all throughout the body. And if you have a plaque somewhere, a large plaque, a little piece of that, if it breaks off, will travel and land somewhere in one of those small blood vessels. And there's a lot of them in the eye. So if that plaque clogs one of those arteries in the eye, you can get loss of vision.
And I read that the body, of course, is 60% water, and the eyes 98% water.
Yeah.
Wow.
Because there's there's water. Well, there's water in the cells, but then there's the fluids that fill the eye are made up of a lot of water too. Yeah.
Very, very interesting. There are so many eye diseases and disorders, like including age-related macular degeneration. Let's talk about that for a moment, because that's prominent in seniors usually. What is it and how to prevent it?
So there's two types of macular degeneration. There's, to put it simply, there's the dry form and the wet form. And the dry form is basically a breakdown of those really deep layers right in the macula. So as we said before, the macula is responsible for your central, crisp, detailed vision. And there's, lots of layers within that. So that really deep layer in there can be a breakdown there, which is macular degeneration, and that would be more the dry form, which is the most common form. The wet form of macular degeneration is you'll have that breakdown, but also when you have wet macular degeneration, there's lots of blood vessels in that pink layer that you see there. It's kind of hard to see from probably the camera, but there's lots of blood vessels, and if the blood vessels break through into that really special, sensory retina that we have that carries all that information, it can cause decreases in vision and ultimately blindness, which is why that's when we send to an ophthalmologist.
The retina is all of this?
All of that. So this is
also
just showing a
called
glow.
the vitreous.
Well, the vitreous is the jelly-like substance that fills that space. So when people talk about floaters, which is something we talk about a lot when, in exams, people will say, I have that little black thing floating around.
That's where they're floating.
Yeah. It's because the vitreous is made up of different collagens and proteins, and as we age, it starts to liquefy, and those collagens and proteins clump together, and we say you're seeing your floaters, but in actuality, you're seeing the shadow created by the floater, because light is entering the eye, it's hitting that little, opacity or that clump of collagen, and it's that shadow's landing on the back of the eye. So you see a black spot, and you can't quite catch it. You just follow it around.
Right.
Yeah.
Wow. So as far as macular, I knew a lady who turned 100, but in the process of her life, at 100, she couldn't see really. And that was a result of long-term macular degeneration.
Yeah.
So, but there are things to take, lutein, and there's something else that goes with it.
Yep, lutein and zeaxanthin is what, So those are pigments that we find in a lot of green leafy vegetables. And when we eat those foods, the macula, that very special part of the back of the eye, is one of the places in the body that really absorbs those pigments. And they act as a UV protectant, in essence. So lots of research has shown that if we have a diet rich in lutein and zeaxanthin, it can act as a way to slow down the progression of macular degeneration.
Oh, good. And you can take that as a supplement.
And you can take that as a supplement. So I tell patients, if you don't eat a lot of green leafy vegetables like spinach, kale, Brussels sprouts, asparagus, all the good things, peas, then you can also take a supplement. And there's a lot of them.
Right.
Yeah, there's a lot of them over the counter, eye vitamins.
Okay.
Yeah.
So let's talk about
one more thing. I'm so sorry to interrupt you. Keeping good cardiovascular health is also one really big thing I mentioned because it keeps those blood vessels healthy. So sorry to interrupt you, Lynn,
No,
but
no,
I
that's
wanted to point that out as well.
cardiovascular. You mean exercise?
Yeah,
and-
getting your heart rate up, at least 2-3 times a week. Just walking is fine. Just kind of getting your heart rate up, getting the blood flowing because it's really good for things like macular degeneration, glaucoma, all
Right,
those things. Yeah.
interesting. Let's talk about, well, you mentioned glaucoma. Let's talk about that. What is it? My mother had glaucoma.
So there's different forms of glaucoma, different reasons why we develop glaucoma, but I think the most common one is when the pressure is high in the eyes. So the eye is constantly producing and draining fluid. It's a constant process because it's nourishing all the tissues. And so if the pressure is up too high, then what it can do is it damages this soft tissue right at the nerve. So the nerve is bringing all these nerve bundles to the back of the eye, and it helps carry all that information to the brain like we discussed. So if there is stress on the optic nerve from high pressure, it can kill off some of those nerve bundles, and then we get loss of vision, mainly out in the periphery, because since our central vision is so detailed and the periphery is, we see in the periphery but not in quite as much detail, there's fewer nerve bundles out in the periphery. So if we have an overall loss, then we'll notice it more in the periphery first. So glaucoma is a disease that affects the periphery, and then of course macular degeneration is our central vision.
And
so
glaucoma, so it's about pressure, eye pressure.
typically, yeah. And so we can do things that can lower the pressure. There are certain laser procedures that help open up the drainage pathway, which an ophthalmologist would do. We would send you for that. And there's also drops that we would prescribe as optometrists to lower pressure, and then we manage that as well.
Right, my mother took drops.
Yeah.
So cataracts, is that something everyone is going to have after age what?
Well, you know what? There's different types of cataracts, and if you live long enough, everybody develops cataracts. You can't get away from that.
And what is it really?
Well, as we spoke about the lens, the natural lens there, some people think cataracts are something grows, in the eye. It's actually just a change of what's already there. So just like the vitreous, this of course is collagen and protein too, a lot more protein, but it's changes to those proteins and collagens that start to yellow the lens. And then it creates kind of this yellowish tint on everything, but it develops so slowly that no one really notices that until all of a sudden they have cataract surgery and it's removed, and then everybody says, oh, the colors are so much brighter, and I thought my stove was clean and now it's not.
So when do you know that you need cataract surgery, aside from your doctor telling you?
Well, cataracts cause an increase in glare. It also creates things just not being quite as clear. We can't get vision quite as good with glasses when your cataracts are to a certain point, but it's going to be consistently blurry. It won't be, temporarily blurry and then you blink and it clears up. It's more consistent because those cataracts don't change.
So in other words, your vision is lowered.
Yeah,
Ability
you
to
just
see.
notice, things become hazy, foggy a lot of times, patients will say, but
But you examine that on your yearly.
Absolutely. Yeah, every time you come in, we look at every aspect of the eye, including the cataracts, and then we have a discussion about, how your quality of life, things, if there are certain things you're unable to do because of your cataracts, like driving at night, for instance, if that's really hard to do, then we can, depending on how your cataracts look, then we can refer you to an ophthalmologist to have a cataract evaluation.
Okay.
Yeah.
Great. Well, let's talk about dry eye disease. We hear a lot about that.
Oh, yeah. Yeah, it's so common.
What is it? I mean, dry eyes, right?
Right, and it comes with so many different symptoms, and one of the main ones that I find, people have dryness, but they don't really notice it, which it's nice not to be symptomatic or feel like your eyes are dry, but a lot of times if we're in an exam and I'm trying to check someone's vision and their vision's fluctuating a lot, that's a sign of dryness. So I'll tell patients, I'll say, do you feel like some days are good and some days are bad? And if the answer is yes, then it's dryness. It's just the tear film on the front part of the eye just isn't stable. And we have, to put it simply, the watery portion to our tears, but then also the oily part of our tears. The oils come from our eyelids. And every time we blink, we express some of those oils, and it spreads it across our tear film, keeping our vision stable. So dry eye could be an issue where we're not getting enough oil. Maybe we're on a computer, we're not blinking as much. Maybe those oil glands have atrophied and they're not all functioning. Or it could be that we have an autoimmune condition and there's a lot of inflammation, or that we're just not producing enough. There's lots of different aspects to it, but yeah, symptoms though, like I said, fluctuating vision, burning, feeling like you have something in your eye. Sometimes it'll feel like it's almost like a needle prick and it'll be gone instantly. You'll just feel like, patients will feel like they have a pain or a needle prick and then it goes away. That's dryness too.
Okay, I have an article about how to stave off occasional dry eye during summer travels.
Mm-hmm.
And of course, stay hydrated, and then it talks about how the eye is 98% water.
Mm-hmm.
And then it says if it's a good idea is to drink half your body weight.
In water?
Yes.
Yeah.
Daily.
Yeah.
That's a lot.
That is.
Wear eyewear. What about blue light glasses? I came upon them recently. I didn't realize, and now my new glasses have blue light in them.
Yeah, there's a lot of so much research. You know, technology advances all the time, and research is ongoing. And now that our society is so, we're on screens all the time: computers, phones, iPads, laptops, TV, and research shows that the blue light can kind of mess with your circadian rhythms, for one, so it's harder to fall asleep. It can also, cause fatigue on computers, things like that. So we recommend blue light blocking, anti-reflective coating for that to reduce eye fatigue. So that helps. Mm-hmm.
Yeah, that excuse me, that did happen to me.
Yeah.
It says also consider wearing a sleep mask to keep the eyes closed.
Yes. Yeah.
And
that helps with dryness too.
And even turning off the air conditioning.
Well, I'm not going to turn off my air conditioner, so I'll probably take a mask.
I do know certain people who consider air conditioning unhealthy and refuse to use it. But of course, that was in California, where the climate is a little more moderate.
Sure.
But
well, fans in your room at night, can cause a lot more dryness too. So,
right.
Yeah.
And when you're traveling, pack eye drops, because I use eye drops daily, really.
Yes.
Actually.
Yeah.
Especially
Good job,
if
Lynn.
especially if you wear contacts, which I'm not right now. But so after age 40, time for reading glasses.
Yes, I would say in general. Now, farsighted and nearsighted individuals, those timelines might be a little bit different, but around the age of 40, between 40 and 45, our natural lens, which we've discussed many times already, the natural lens actually does a lot for our focusing. So that helps. It's very robust when we're young, and when we go to look at something up close, it's functioning well so we can see. But around 40 to 45, it just doesn't function as efficiently, and that efficiency gets less and less as time goes on, and that's when we start to notice things are getting a little blurry, and we start to need reading glasses or some sort of assistance oftentimes.
Right. And then people who do wear contacts, what are the positives and the negatives? Quickly.
Well, contacts are a nice freedom from glasses. So for patients in sports or wanting to do outdoor activities or not wanting something on their face, contacts can be a great option. And then, glasses, obviously, if they don't want to wear contacts. But if somebody has vision in one eye and not in the other eye, contacts might not be as good of an option because it doesn't offer the protection that glasses would. So that's kind of a con to that.
Interesting.
Yeah.
And I know people who have close up in one eye and far in the other.
Yep.
I
That's
never
called
wanted
monovision.
I never want. I mean, as far as contacts.
Yes.
I go, no, I don't want that.
Yes. It works really well for some individuals and not for others. So the brain has to kind of decide what's happening.
Which eye do I need to use now?
Yep. And then, but eventually your brain clicks, and then it's pretty easy. So, but it's not for everyone.
Oh well. So most people might know, but explain farsightedness and nearsightedness. It's the meanings are opposite from what you think. So if you're farsighted, you can
see far. Yep. But it's harder to see near.
And if you're nearsighted,
you can see near, but not far.
Wow.
Yeah.
How about diabetic retinopathy?
Diabetic retinopathy. So when patients are diabetic, the blood sugars can weaken the vessel walls, and we talked blood vessels are important for the eye in so many ways. So if the blood sugars are weakening those vessel walls, then we can start to see blood that leaks out. And so when you come in every year, if you're diabetic, for a diabetic eye exam, we will either dilate or do a photo, and we look for signs of any bleeding or areas where the retina is not getting enough oxygen. And if there's bleeding or lack of oxygen, we call that diabetic retinopathy, and then we report that back to the doctor, and then between the patient and their endocrinologist or their primary care, whoever manages their diabetes, then they can make decisions off of that.
Right, because I do have known a diabetic who had vision problems.
Yeah, it can,
Sad.
There's mild all the way, there's a whole, it's kind of a mild all the way up to severe, so yeah.
Right. Well, yes, I mean, we could go on and on.
We could.
A to Z I saw
sure could.
Online. It's like, wow, A to Z for eye disorders and diseases.
Yeah.
For example, retinal detachment. What is that?
Oh, a retinal detachment. So when in the back part of the eye, the retina, back in there, that sensory tissue can detach. And so if that is happening, there's different symptoms that you might notice. One might be, flashing lights in your periphery. One might be a dark curtain that blocks the peripheral vision. Or it could be a bunch of floaters all at once. Those are symptoms that you could have if you were having a retinal detachment. Reasons to go see your doctor right away. And if that were the case, we'd send you to an ophthalmologist, and they can repair that.
Well, just briefly, I know we've talked about it, but how to maintain good eye health, and you said by maintaining your health overall.
Yes.
Basically.
Yes, maintaining health overall, making sure that, you're seeing your primary care doctor every year, taking medications if necessary, getting out there and exercising, trying to make good diet choices,
Live a good, healthy life.
Live a good, healthy life. Do your best and forget the rest,
All right.
That's
I
all
like
we
that.
can do.
I love that. So, golly, we've learned so much, and there's still probably a lot more to learn. But
always, yes.
it's very informative. Thank you so much for your great contribution today, and we'll all be seeing you. And you're my doctor, I know, and Tim, who's here, your doctor.
Yeah.
You probably run into a lot of people in the street, and you go, I think I know them.
I know. Yes, I do. It's awesome. I love my patients. It's awesome.
And it's an
I love it
awesome
so much.
career that you've chosen.
Thank you.
So thank you.
Thank you.
And thank you for watching this issue of Senior Living. Please join us again next time for another important topic of interest. So until we meet again, this is Lynn Brennan saying goodbye for now. Happy, healthy aging. See well, and God bless.